Hello, and thank you for joining today. My name is Michele Toplitz, and I'm the Program Director of the National Academy of Medicine's Initiative on Transforming Systems for Climate and Health. Welcome to Day 2 of our second information gathering workshop, The How of Systems Transformation, Strategies and Levers for Health-Centered Climate Action. We're very excited to continue the conversation and look forward to learning from another esteemed group of experts and influential leaders participating live from around the world, all with a view to centering human health and well-being in the climate agenda. Next slide. Before we begin today's program, a few quick housekeeping items. Today's session is being recorded, and the video and presentation materials will be shared on the NAM website in the coming days. We hope members of the public audience will actively participate by sharing reflections and submitting written questions in real time for our speakers. To do so, we encourage you to use Slido, our live Q&A platform. It's very simple to access. Just enter your name, check the box, and click Join Slido. Once in, the blue bar below the video player will give you access to submit questions and view others' questions. Each session today has time set aside for Q&A, and we'll aim to address questions as time permits. And with that, I will turn things over to Dr. Jonathan Patz, who will provide his reflections and key takeaways from the first day of the workshop. This framing will orient us well as we kick off today's discussions. So Jonathan, over to you.
Michele, thanks very much, and welcome everyone to this part 2 of the How of System Transformation. Strategies and levers for health-centered climate action. Now, you may recall that part 1 took place on Friday, July 25th, just over a week ago. And my task, with the help of some NAM staff, is to summarize some of the key takeaways from the presentations and discussion that occurred that Friday. So I want to just quickly summarize to orient everyone. In session 1, framing the levers of transformation, that opening session introduced NAM's emerging mental model that underscores the importance of political, financial, and social realities while ensuring adaptability across diverse cultural and national contexts. We all know that technical solutions and data alone are not enough. Enabling conditions like time, trust, and appreciation for cross-sectoral work must be intentionally created and resourced. Transformative change entails visible trade-offs and potential winners and losers, and avoiding that reality weakens our credibility. Systems thinking must account for political cycles, financing structures, and the realities of who bears the cost versus who reaps the benefits. There's no universal roadmap for systems change. Success depends on building relationships, fostering shared vision, and creating space for co-design of locally relevant solutions. Investment and relational infrastructure, such as cross-sectoral convenings, inclusion of key stakeholders, and fostering the capacity for systems thinking are foundational to lasting progress. So after that session, session 2 focused on metrics to move the systems. This session examined how metrics can function as levers to drive, not just describe, systems change with a focus on health-centered climate action. Speakers explored detection and attribution science, global indicator frameworks, the integration of health into national policy processes like the nationally determined commitments for greenhouse gas reductions, the NDCs, and the evaluation of health co-benefits of climate policies. Current climate health metrics often focus on outcomes, mortality or disease incidence, but rarely measure the intermediate enabling conditions or systems dynamics that lead to transformational change. So tracking governance, finance, and institutional capacity are essential for motivating and sustaining action for change. Advances in detection and attribution science now allow quantification of health impacts directly attributable to human-caused climate change. And if some of you saw the news, attributing the heat wave in June in Europe showing that 65% of the deaths could be directly attributed to burning of fossil fuels. These types of quantified impacts have strengthened legal cases, informed national policy debates, and reframed climate change as a current public health mandate rather than a distant risk. Multiple overlapping indicator frameworks, for example, the Lancet Countdown, the Global Burden of Disease, they're out there, but we need alignment and standardization, especially aligning climate health indicators to existing Sustainable Development Goal targets, which would be more readily in support of national implementation. Metrics are likely to drive change when they are embedded in key decision systems, budgeting, regulatory standards, investment decisions, and are contextualized for national and subnational priorities. This includes making the economic, development, and policy cases for health-centered climate action. Evaluation of implemented policies is also essential to confirm the health benefits are occurring, discover unintended consequence, and guide mid-course adjustments. Mixed methods, approaches, and metrics related to equity can capture real-world impacts more effectively. And finally, process indicators that capture inclusivity, governance quality, and participation of marginalized and indigenous groups are vital. Metrics should reflect not only what is measured, but how measurement is designed. And the last session, session 3 from last Friday, addressed shifting systems through culture, narrative, and behavior. The session explored how cultural, narrative, and behavioral strategies can drive large-scale systems change, drawing on lessons from landmark efforts in tobacco control and sanitation reform in India, and unpacking how those insights can be applied to climate and health agenda. The discussion emphasized the need to move beyond surface-level behavioral change tactics into deeper shifts in values, norms, and power structures. Successful large-scale movements, such as global tobacco control, paired parallel narratives with policy action, calling out harmful industries as accountable actors or actually villains, and galvanizing collective pressure for change. Climate health narratives must likewise move beyond individual responsibility toward confronting systematic drivers like fossil fuel dependence and the bad actors, that maintain the status quo need to be called out. The messenger is equally as important as the message. For example, the health sector's trusted standing offers a powerful platform for reframing climate action as a public health imperative. And while behavioral interventions have often targeted personal habits, the same tools, framing, social modeling, norm activation, can be applied to influence institutions' policies and market behavior. The shift from micro to macro level application is critical to avoid reinforcing individual blame narratives like BP's carbon footprint calculator or 3M's anti-littering campaign that focused on it's your fault for littering rather than the upstream industrial engine that is causing the problem. Climate health strategies must be grounded in cultural realities and aligned with the lived experience and values of the communities they aim to reach. As seen in India's sanitation efforts, ignoring entrenched social hierarchies or failing to address structural barriers can undermine the uptake and reinforce inequities. Finally, framing climate action around tangible, near-term health benefits like cleaner air, safer housing, healthier communities can make the transition more relatable and politically durable. Success is more persuasive when tied to improved well-being, resilience, and equity rather than abstract or future climate targets. So in a nutshell, that was what transpired on July 25th. and that tees up this next part two, which is divided into two sessions. So here you have the slide. In session 4, Rethinking Economic Value in Climate Health Action, that will ask the question of what shifts are needed in how we define and measure value in order to drive health-centered climate actions. There'll be a break, and then we'll come back to session 5, Mobilizing and Redirecting Capital for Climate Health Action, which will ask the question of how can we align financial flows and investment priorities with these redefined values to accelerate health-centered climate action. So with that summary and orientation, I want to introduce you to Dr. Judy Rodin. She's the co-chair of this NAM Roadmap Initiative. She's the former president of the University of Pennsylvania, as well as the president of Rockefeller Foundation before that. So Judy will be moderating the first session today, and I will hand this over to Judy.
Grace, can you hear me now?
Yeah.
Okay, great. That was a great recap of the first session, which was so lively and energetic. And I hope many of you who are on with us now had the opportunity to hear it. But if not, I think you got all of the really important kernels just now. I want to give a warm welcome to everyone joining us for this important discussion. As you heard, the focus of this first session today is how to reframe our current economic model. Can we do that reframing and create a new economic model that would contribute to financial gain and prosperity, but without negatively impacting the climate or human health, or even one that, if we were very fortunate, positively impacted the climate and human health? At the heart of every major decision, whether it's by a government or a bank, a philanthropic foundation, or a private investor, there is one constant. And I want you to think of that throughout this session. And that is a judgment about value. What is worth funding? What is worth protecting? What is worth the risk? How important are the financial outcomes we're seeking? The challenge before us, I think, is that our prevailing economic frameworks are not really broken. They're functioning precisely as they were designed. But those designs are no longer serving us as well in the context of climate and health. Even when there have been improvements in these frameworks, and there have been some, they're barely capturing the true potential economic value of climate health action. Budgets, loans, loan decisions, investment models, they're all still anchored in measures like GDP growth, short-term returns, and narrowly framed cost-benefit analysis. In these models, the health gains of climate action and the resilience dividends they generate are consistently undervalued. This isn't simply a technical oversight, it's actually a structural blind spot. The reality is that many of the health impacts of climate change and many of the health benefits of ambitious climate action never make it into the models that drive financial and policy decisions. When benefits are less visible, they're almost always undervalued and poorly measured. And when they're undervalued and poorly measured, they are inevitably underfunded. That's what makes today's conversation so important. While we will be tackling political and behavioral, social variables as well in these workshops, this session today actually is focused on finance and the economic systems that drive it. If we want health-positive climate action at scale, it must be economically valued explicitly, transparently, and systematically in terms that drive real resource flows and influence real-world decisions. That means we need to interrogate the status quo in order to change it. We need to ask, how and why climate health value is or isn't reflected in current economic systems and in current financial decision-making. What promising new valuation frameworks, tools, and metrics are emerging that could begin to close those gaps? And critically, we must ask how we can reconfigure financial and policy systems so that investment in health-positive climate actions are rewarded and not deterred, and so that these investments are configured to yield financial gains, not just costs. Over the next hour, we'll hear from experts who are working directly on these questions. They will help us understand where and how value is being redefined, what it means for financing, and what it will take to embed these changes in the systems that guide investment and policy and practice. And so with that, I am delighted to begin with our first panelist, Elizabeth Robinson, who's the director of the Grantham Research Institute and acting dean at LSE's Global School of Sustainability. Liz, over to you.
Thank you so much. I'm an environmental economist. And if we go to the next slide, my sort of starting point for framing is that environmental economists and health economists, we're increasingly looking at that climate health nexus, but from quite different perspectives. And so I'll give you my perspective as an environmental economist. I think you've already heard a little bit about these sort of health co-benefits of tackling climate change. For example, air pollution, active transport, plant-rich diets, more green and blue spaces, and then actions we could take through adaptation and litigation. And certainly from my perspective, why this is an interesting approach to take is because tackling climate change is a global public good. So a country may do its best to reduce emissions, but the benefits are global. And so you don't get that direct economic value in your own country or locale. But if we look at those health co-benefits of tackling climate change, they're often local. So you get those local or national public goods, health co-benefits. For example, if we reduce air pollution, we're contributing globally to that public good, but locally we're reducing the impact on the health of our populations, taking the pressure off healthcare services. So in terms of framing, environmental economists, we tend to not really focus on the healthcare sector, except where actions that are taken to tackle climate change take pressure off the health services and social care services. On the next slide, I just want to highlight the two areas that I'll talk about today. I was asked what is currently undervalued, and I'm like, oh goodness. As economists, anytime there's an externality or public good, we think it could be undervalued if we don't have the right policies. But I thought I'd give two examples. One is healthy aging across the life course, and one is the heat impacts on the workforce, the labor force, and those associated costs to the health service, to firms, and the fiscal drag on the economy. So on the next slide, I'm not going to give you any numbers or answer these questions because I don't think we've still done the right economics to figure it out. But I think there's just insufficient understanding or attention to the idea that healthy aging is actually a climate adaptation and resilience strategy. So if we have healthier populations, and especially I think, I started talking with a colleague of mine at LSE, and she was talking especially in the sort of context of Southeast Asia and China, where you've got very low population growth rates. So you could have actually shrinking populations. And so you've got a much larger proportion of older people relative to younger people who are going to be paying those tax dollars, those tax yuan, to support the pensions and healthcare of older people. So if we have a healthier population across the life course, that's going to take a tremendous amount of pressure off our health services. And we know that climate change tends to be most problematic for older people, less healthy people, and people with pre-existing health conditions. So tackle healthy aging along the life course, and you've actually got quite a good resilience strategy. On top of that, if we think about what it means to age in a healthy way, that actually contributes to mitigation, climate change mitigation as well. Because again, you're going to hear these themes all the time from people like me, anyone at the Lancet Countdown. Active transport, that's getting people out of their cars onto bikes, walking, public transport where they can, access to clean air and balanced diets, all those activities also reduce emissions. So I think costing, what does it cost to have a healthier population? It's relatively easier. What those benefits are, for the local population, for the country, and globally are harder to cost. We can have bounding arguments where we can say at a minimum, but it's still tricky for us to figure out what those benefits are and who realizes those benefits. So I always say all roads lead to finance these days, not Rome, especially with climate change. And often the people we really want to talk to are the Treasury departments, our ministries of finance. And for them, they really want to know the cost implications, the tax revenue implications, not necessarily the global benefits. So on the next slide, I just thought I'd talk a little bit about heat in the workplace, which I think still isn't being taken seriously. I'll just give you some examples from the UK where I've done some recent work. So we have protections against cold, but not against heat. That makes sense. When I was a kid, we were a typical wet, damp, Northern European country with a Northern European climate. I don't really remember thinking, wow, I'm hot in England, but I would often feel I'm cold and wet. But now we have increasingly a Mediterranean climate with Northern European infrastructure. And we're finding that workers are having to choose between protecting their health and protecting their income. They may often end up compromising both. And heat is affecting health, well-being, company profits, and is a fiscal drag. That is, it's affecting GDP. So on the next slide, it's a cluttered slide. We're not supposed to show cluttered slides. But here, what we've done is some work to show that the warming due to climate change is actually reducing labor supply, reducing productivity, and having a negative effect on climate change. And so the idea behind this graph and the next one is that if it's very cold and it warms, we see labor supply and productivity go up. But above a certain temperature, and in the UK, that's an average temperature of about 9 degrees, if it gets any warmer, then labor supply and labor productivity fall. And why is that? Well, we slow down. When it's hot, we might work fewer hours. We might take more rest breaks. And quite possibly, we're putting pressure on our health and not even realizing. And we know we particularly have to worry about people with pre-existing health conditions. And we can now attribute these economic outcomes as well as health outcomes to the changing climate. There's lots of complicated data and econometrics behind these figures. But we've calculated that about 29 hours per worker per year are being lost because of warming that we can attribute to anthropogenic climate change. On the next slide, I show some results for continental Europe as well. Basically, in the already hot countries, the warming is making productivity and labor supply lower. So that's the Mediterranean. And in the countries that are colder, Northern European countries, Scandinavian countries, warming actually seems to be benefiting a little bit labor supply and labor productivity. And again, you can see on the text there, we can figure out just by how much. On the next slide, I'm showing what the impact is on GDP. So this is data on GDP per capita over time. And again, we can tease out of the data with complicated econometrics that in Southern Europe, GDP per capita growth is lower than it would have been if we hadn't had warming. Health is being harmed, but we really don't have a good knowledge gap of how it's being harmed. And on the next slide, again, just to say this is not just a European story. These are data from Africa using different methodologies, but a similar point. GDP is being harmed due to warming, and we can tease out from all other sort of causes how much is due to warming. And you can see in Southern Africa, not surprising, it's cooler, not such a big deal. In West Africa, where it's hot and humid, a much bigger deal. So I think just the final slides, if we look at the next slide, if we were to design a healthier, climate-friendly society, we would have clean air, we'd all be able to be active to our old age, we'd have access to affordable, healthy diets. And that's the end of my framing presentation. Thank you.
Liz, thank you so much. That was enormously helpful. I'm now pleased to introduce our next presenter, Stéphane Verguet. Stéphane is Associate Professor of Global Health at the Harvard Chan School of Public Health. So, Stéphane, over to you.
Thank you for a kind introduction, Judy. What I want to do in the next 5 minutes or so is giving you 3 considerations, actually, for priority setting within the health sector. Next slide, please. And what I want to frame to start with is to reminding you of the carbon emissions from the health sector. This is about 5% of global emissions, up to 10% in high-income countries. The health sector actually represents a large share of public sector emissions. These emissions are linked to availability, utilization, quality of the healthcare, but also, of course, local energy systems and health expenditures. Speaking of, we anticipate vastly rising health expenditures in many low-middle income countries in the decades ahead. So anticipating as well, possibly, vastly rising carbon emissions. So the question is, how can we curb those trends? Next slide, please. So what I'm going to go over now is three considerations for priority setting, and again, talking from the health sector perspective. The first is mitigation and priority setting, and I'm going to propose three quick possible approaches. The first, it's the easiest one, is to invest in low carbon interventions to minimize carbon emissions without reducing health, of course. They are, and we're not going to go into multiple examples. I give a couple here. There's numerous options within the health systems that are possible to do that. A couple of examples here: low carbon inhalers or low carbon anesthetic agents. Next slide. A second approach, second take, would be to as Jonathan was framing a little bit, to be explicit about adding carbon emissions as one supplemental criterion for health priority setting. In the health sector, often what we find is multiple criteria are often used for intervention prioritization. These are disease burden, budget impact, cost effectiveness, equity, financial risk protection. These are quite classic, common criteria that you see. And so what we could do is just being very explicit about adding one additional criterion, which would be the reduction of carbon emissions. So next slide, please. So what does that mean? So it means that conceptually, we need to optimize both carbon emission reduction and health gains under a limited budget. And I'm trying to illustrate this with the graphic that you have on the right-hand side here. Think of some investments in some intervention. So you have a certain budget per dollar spent. Then that intervention, that health sector investment would play out in two dimensions, okay? Health benefits per dollar spent, that's what you have on the x-axis, and then carbon reduction benefits per dollar spent on the y-axis. And so, of course, many situations can arise, but I'm going to emphasize three of them. The first, which is on the top right corner, is the one of large health benefits, large carbon reduction benefits per dollar spent. We would call them win-win strategies, right? No-brainers, we should invest in it. Perhaps this is related to more prevention, to more primary care interventions that are very cost-effective, pollute less as opposed to hospital-based care, treatment, tertiary care types of interventions. So that situation is quite easy, right? Second situation is on the right-hand side of the graph. Imagine you have two interventions. Both have the same health benefits per dollar spent, okay? And one has lower carbon emissions, the other one has higher carbon emissions. So then in that case, again, quite simple. What you do is that carbon reduction would act as a discriminative criteria to the selection. Now, of course, there's a tricky one, which is the third situation, which I'm highlighting on the top left corner, where you have small health benefits per dollar spent, large carbon reduction benefits per dollar spent. And then here, that probably is a difficult one, meaning that would imply value judgments from decision makers, the society at large, and then trade-offs. And perhaps actually unacceptable trade-offs that, really the health system, its primary intent should not to sacrifice health for environmental sustainability, and rather we would invest in environmental sustainability interventions to reinforce the health system functions. Next slide. So now a third easy option could be, if we want to avoid that difficult trade-off, is to focus only on the best buys in carbon reduction, to seek health interventions that maximize carbon emission reduction benefits per limited budget. And this is illustrated by the simple graphic on the slide, where what you would do is that you take possible intervention investments, and then you rank them depending on how they score in terms of carbon emissions reduced per, say, $1 million spent on that given interventions. And then if you do so and you have that dimension as your metric, you're able to identify best buy interventions, those that are most efficient in terms of carbon reduction. That would be the bars, the green bars that you have on the left-hand side in this simple graphic for illustration. Next slide. Next, yeah. So the second consideration is that of adaptation and priority setting within the health sector. So we all know that there's a rise in climate-sensitive diseases, and what that means is that there's increased demands on health systems, especially those with low adaptive capacity in low-middle-income countries. So it means we need to design climate resilience of systems. And to do that, we really need to think about identifying what are cost-effective interventions that can minimize the climate impact, these climate shocks on health. In other words, how do you define a priority package of best buy interventions that you can roll out before, during, and after acute events? Next slide. And the third consideration is, and the last, is distributional issues and equity are absolutely key, okay? There's, we all know, there's a superposition of several socioeconomic gradients at play, and Lee's already alluded to a few in her remarks. On the one hand, you have large inequalities in carbon emissions within and across countries. On the other end, what you often find is the poorest, often bear the largest burden of climate-sensitive diseases, the consequences of climate change, both within and across countries. And then in the meantime, what you find is that the weakest health systems, the poorest countries, often are the most vulnerable to those climate shocks. Next slide, please. And so this is actually an opportunity. In other words, mitigation and adaptation policies could be an opportunity to redress inequalities. We certainly need to do a much better job to systematically assess the distributional impact of climate and health policies, of those mitigation and adaptation actions being implemented. And if we do so, I think we have an opportunity to show that how, if we invest in climate and joint climate and health policies, we can efficiently reduce overall inequalities. And ultimately that deals and that relates to social protection goals, social contracts, and that can be quite attractive for ministries of finance, government heads, especially those who pay close attention to the evolution of poverty reduction policies and inequality reduction policies. Thank you for your attention.
Great. Thank you so much, Stéphane, and thanks to you and Liz for these introductions to our expanded conversation. And I appreciate in particular that you gave us such explicit examples and really created a conversation around the frameworks that we would need to develop in order to take much more effective climate health action. Your conversation so far has raised really the fundamental truth, and that is we invest in what we value, and we also measure what we value. But it also raised, I think, two critical questions. Who is the we? Who is it who decides what counts? And what happens when those definitions diverge across systems and sectors? These aren't really abstract questions. They show up in the fine print of loan agreements, in how investors define risk and responsibility, in what donors may consider as impact, and certainly in the calculations that governments use to balance the cost of action and the cost of inaction. So we now turn to our anticipated discussants as well, to bring them into the conversation. They will help us unpack these tensions and surface solutions. Each of these discussants brings a distinct but I think complementary vantage point from the worlds of private investment, philanthropy, and public finance. Amit Bouri is CEO and co-founder of the Global Impact Investing Network. Boon Heong is executive director and CEO of the Temasek Foundation. And Kevin Urama is the chief economist and vice president for economic governance at the African Development Bank. And we thank you for joining this conversation. Let me start, and I'll turn to each of our three discussants first with this question. Do you see currently a focus on the climate health nexus in your work, in the sector in which you work in? And if you see it, can you show us how it is creating value or how it potentially could create value? Amit, maybe I'll start with you.
Thank you so much. And I just want to say to this panel and thank you to the Commission for leading the charge on this important conversation. So briefly as background in terms of the perspectives that I represent, so the Global Impact Investing Network, or the GIN for short, is an organization that's a nonprofit based in the US that supports a global network of investors, over 450 formal members in 60 countries that are financial institutions. So everything from large global banks to pension funds, insurance companies, some corporates, as well as development finance institutions. And they are all kind of investing for what we call impact investments. And these are investments that are designed to generate both a positive financial return as well as a positive social or environmental impact that is intentional and measurable. So we have a kind of a global network of investors who are all putting capital to work to invest in addressing social and environmental problems. And so this conversation is incredibly interesting to our network and is increasingly of relevance. We have certainly seen a lot of investors who are focused on addressing social inequalities, including issues around health care inequities, like healthcare access, increasing the availability, whether it's in developed markets or in emerging markets, so lower-income people can get access to quality health services. We've also had a large community of investors who are focused on the environmental issues, and of course, leading the charge on that is climate mitigation. To your question, Dr. Rodin, I think one of the things that we're seeing an emergence of in the last several years is an appreciation of this intersection between climate change and its impacts on low-income populations. And that's playing out in a variety of areas, including in health, although I still think we're just starting to scratch the surface on the potential that we can see for investors who are, either who care about climate change and increasingly understanding its social impacts, including impacts on health. And those investors who are more focused on inequality and things like health inequities, and are increasingly, understanding that addressing climate change will be important to addressing health inequality going forward. So I think this is very much an emergent area, but I do want to talk briefly about kind of where we see this kind of, this conversation unfolding at a kind of in terms of what it means that investments are supposed to accomplish. Because I think this comes to some of the upfront framing for this conversation. Fundamentally, we have investors who are just trying to do two things at once: achieve financial returns and achieving social and environmental impact. This has a ton of momentum globally. I was actually just in Singapore on Friday meeting with Boon in his office and among others. And we see a lot of interest in this all over the world. And I think what it gets to is that, when we get to this higher level systems conversation, is fundamentally what do we want markets to deliver? We want them just to deliver economic growth and economic gains for those people who are investors, or are we looking at our markets to deliver a better society, including sustainability from an environmental perspective, but also from a social perspective? We do see a lot of momentum around that latter version of markets should deliver more than just money for those who already have it. But we still are building out many tools and measurement techniques and valuations to help investors understand what types of investments actually deliver positive impact, whether it's on climate or health or both. Thank you.
Great. Thank you so much, Amit. That was extremely helpful, and I think quite clear from private finance and its perspective. We have a last-minute substitution for Kevin, and I apologize, Eric, for introducing you improperly. But we have Eric Ogunle, who's the director of the African Development Institute at AIDS, at the ADB, I think, the African Development Bank. So Eric, over to you for private finance in answer to the same question. That is, how do you see in the private finance sector a focus on the climate health nexus currently or potentially creating value for your work?
Okay, thank you very much. No worries about the introduction. I'm actually sitting in here for the chief economist and vice president of the bank, so it's okay. Let me start from a general perspective, especially with regard to some of the issues that we see in Africa as a development finance institution on the continent that helps to better understand the issue of how we see the key issues. First is to establish, and I like the framing discussions that have been made earlier. I saw a lot of reference to Africa and some of the challenges even across the sub-regions within the continent. So that points out to the fact that Africa really faces a very high set of shocks and crises, which tend to undermine or even reverse some of the hard-won gains that many of the countries have made over the years. As we know, Africa is acutely vulnerable to climate change, to health crisis, to global economic volatility, and also conflict. So what that means, therefore, is reducing inequalities, particularly in education and health, will help boost the skills and health of the workforce, which we know is essential to increase productivity and innovation. And the pressure from climate change is actually undermining Africa countries' ability to cope with other crises, crises such as health threats, global economic turbulence. And so investing, therefore, in more resilient health is essential to contain the future disease outbreaks and also the disruptive effects and also global health security that we see. So climate change confronts Africa with very high, profound risks. But it is interesting to know, however, that the continent is also a key part of the solution, even though they face these challenges. And so it is important, therefore, that we focus on strengthening resilience to climate change. And this can be achieved through adequate climate change adaptation, mitigation measures, and so on and so forth. So that is the reason, because of the critical role of the bank as a development financial institution on the continent, we have developed a 10-year strategy that focuses on how we can strengthen resilience to climate change and to improve health systems on the continent. These are the key priorities of this strategy that will run between 2024 and 2033. And now, talking about public capital, indeed, public capital should be used to leverage private capital. And in Africa, we have a lot of private capital that are locked up in so many funds, pension funds, insurance funds, and so on. So the role of us as public capital mobilizer is to ensure that we leverage this private capital so that we can then ensure their proper use for investment in climate health-related projects. It's also interesting to point out that the multilateral development banks recently adopted a reform agenda, which aims to make them bigger, to make them bolder and better. And this reform agenda provides an adequate framework for strengthening the mobilization of public capital for investment to support inclusive growth, to support sustainability development, as well as health-related issues. Maybe let me also further point out that one of the key areas too where we see these issues as it relates to our work are the public commitments that have been made, especially by the political class on the continent. We have seen cases where for over 2 decades now, there have been some commitment made by the political office holders at African Union Commission level. The first one, of course, was done as far back as in Gaborone, where 10 African countries committed to ensuring that they will, focus on integrating the value of nature into the national policies and programs of the country. They also, committed to recognizing that nature is needed for economic growth and sustainability. So what we're seeing, therefore, is to ensure that in whatever we do in some of the projects that we finance in most of the countries, we take into consideration the nexus between health, education, and other key challenges that are inhibiting progress on the continent to ensure that support is provided to the countries. Maybe one last point to make is the fact that just to illustrate further the political commitment is to say that we at the bank had received a matching order, if I may call it so, that the bank should lead a research that can assist to understand better how the countries on the continent can further leverage their natural capital, especially when it comes to integrating it into the GDP. And we did a study, which I'll be happy if I have a few more time, maybe later, a few more minutes later, to assess some of the key findings that we have and how this relates to the work we do. But ultimately, it is the knowledge that we are generating in this perspective that is shaping the work we do, that is dictating how we support the countries, and that is also helping us to understand the issues better.
Thank you. Thanks so much. Well, we've heard really eloquently about the use of private capital and public capital. Boon, let me turn to you, and we'll hear about the use of philanthropic capital strategically in answer to this question of the climate health nexus getting the support that it needs.
Thanks, Judith. Just a quick introduction. I'm Boon. I'm CEO of Temasek Foundation. Just a quick background. Temasek is a global private equity investment company headquartered in Singapore. The key markets is Asia. Of course, there's also investments in Europe and in America as well. Now, every time when Temasek, the investment company, makes a return above its risk-adjusted cost of capital, a percentage of that wealth added is automatically set aside into a philanthropic or community fund, as we say it. That fund is then gifted out in endowment, and a trust, Temasek Trust, manages it. And the foundation then has many people say they have the privilege, but I would say they have the burden of taking a percentage of that return and deploying it towards projects. And how do we deploy those capital? We use philanthropic capital as risk capital. In risk capital. So in everything that we do, we use it as risk capital to push for innovations, to push for different pathways to solve social and environmental problems. And our ultimate objective of doing pilot projects is so that those projects could be scaled up. For us, philanthropic capital is minuscule as compared to private sector or public sector. So right from project origination in everything that we do, we partner with the government and also with the private sector. The government is useful because the government formulates policy. The government can also support program in the scaling up. Private sector likewise. So as an example, the pilot programs that we have in Singapore for healthcare, about 60% of them are actually mainstream so that in Singapore, so that everybody in Singapore can benefit from it. And the main agency that mainstream this is the Singapore government. Now, on the climate and health nexus, I just want to highlight two examples. Liz, your presentation on heat really resonates with us in Singapore. I think about 15 years ago, dean of one of our university reminded me that about 15, 20 years ago, in the textbook of our middle school, it was indicated that the nominal temperature in Singapore was about 28 degrees. Today is about 35. And so it's extremely hot and humid in Singapore. And what do? We run into air-conditioned rooms. And as a result of that, I did my medical health check recently. And then my doctor told me that I'm vitamin D deficient. Because of the heat, I'm not going out into the outdoors to exercise. And I'm vitamin D deficient. and I have to be on vitamin D supplement. So it's what an irony, right? So that's one example, and how important the nexus of climate and health is. The other example that I just want to highlight is what you mentioned about air pollution as well. But I think one of the most understated issues of today is forest fires and wildfires. You would know forest fires and wildfires actually occurs all across the world, in Southeast Asia, in California, in Africa, in Australia. So in Singapore, in 2015, about 10 years ago, forest fires around Southeast Asia, in Malaysia, in Indonesia, in Thailand, they were all burning. And as a result of that, there was a smog, and the pollutant standard index in Singapore in those countries were atrocious. There was a huge transgression, to climate change, to environment, but there's also a huge impact on the healthcare. Just last week, 2 weeks ago, we noticed that the forests around us are also burning. There were hot spots, and when we asked, it was because the temperature was extremely hot, the weather was extremely dry. So climate change, does have a direct impact on healthcare as well. And so we do have to take that really seriously. And at the foundation, we try whatever we can at the policy level and innovation to try to catalyze and engage with stakeholders to make sure those issues are looked into.
Terrific. Thank you so much, Boon. Thanks to the three of you. I think we've had very clear and well-articulated examples of how each sector sees its role. And Stéphane and Liz, now I want you to jump into the conversation too as we continue, because I've been trying to think about how strongly to stipulate the need that in order to continue to reframe a new model, we need to put out front the sort of articulation that the investors need to continue to be able to show impact, whether that's a financial gain for the private sector or a social and health gain for philanthropy and the public sector, but that we need, with that stipulation, to reframe what we value and how we measure what we value in order to make this health and climate nexus even more impactful and even more upfront as these decisions are being made. So what more do we need to do? And any of you, either jump in or pop up a hand, or Liz.
Please go first.
I thought I might just respond to something that Amit said, which you said, what do we want markets to deliver? And I often sort of say, and it's not flippant, I say, how do we align fiduciary duty to our shareholders with not destroying the planet? We have a duty, and private sector has a duty to its shareholders, and yet a lot of what those actions are doing, we know because of those global externalities, are not aligned with long-term benefits to the planet. So that's certainly a starting point, and certainly demonstrating what the costs to global health are is a starting point. But that doesn't help the problem of how we sort of punish the share price if there's a negative externality from the actions.
Should we punish the share price? Should that be built into the consideration that I, as an individual retail investor, for example, make when I'm deciding what companies to invest in? I was president of Penn when students protested about the sweatshops that we were using in South Asia to make our athletic wear with our logos on them. And it was the consumer, the conscious consumer, who really changed the behavior there of the companies that were making that athletic apparel. Do we need something similar, if you will, in this area that influences how these sectors make their decisions? And what would that be? Go ahead.
I was gonna go in a slightly different direction, responding to your question, Judy, in terms of in fact, the way you framed what we what we measure, what we value, and what I would add also is for what decisions. And so just quickly on the my take, and I felt, I really like the remarks by our three colleagues here. They were very concrete. And so what I would say is that it's important that we measure tangible things, especially for the health sector, perhaps things that are near term. And also, how do we put this together, as I was trying to explain in some way, in a framework for setting priorities. And so that then, people can leverage those indicators for then, putting actions into place.
Yeah. Maybe turn to our three discussants again to ask, do you see things in your sector that might prevent convergence on a shared value framework between philanthropic, public, and private sectors? Because we as a commission want to be very smart about where the obstacles are, not just where the opportunities are, and to understand them and to really think about what the mitigants might be. That's what a real roadmap will actually need to confront in order to be successful. Amit?
Yeah, first, thank you for the comments and the questions. There's a lot of different topics on the table, so I'll pick up where you left off, Dr. Rodin. So a few things on our minds. I mean, one, we do think we need kind of consistency around the measures themselves. We've done a lot of work as an organization at the GIN on developing a system called IRIS Plus. It's actually first formulated and set up in part by the Rockefeller Foundation when Dr. Rodin was leading the institution. And it's designed to give investors a common language for how they measure and manage impact. So it's organized by theme. So in health, we look at a number of strategies with concrete metrics that investors can use to understand whether or not they're driving positive outputs and outcomes. So it could be around increasing access to quality care or increasing access to devices and medicines and other areas that allow investors tangible ways of measuring their positive impacts along core strategies in health. Now, this is something that we have a large portion of the development finance and impact investing community, so private and public-backed financial institutions around the world are using this. It's a free resource, it's a public good. But what it does is it gives people kind of like direct metrics. Where I think there's a blockage, two thoughts to put on the table. One is we could use consistent signals from governments around how investors can actually measure the right thing. So we have consistency enforced, not just from a voluntary effort led by organizations like the GIN, but actually through governments who write the rules for the market. And could articulate what types of data could be tracked, what could be used to inform decision-making amongst investors, policymakers, and beyond. The second area that we've started some work on where we see a gap is we've seen a tremendous amount of progress around climate change because we do have kind of a unifying metric, which is greenhouse gas emissions. So a whole bunch of different activities can be boiled down to something like GHG emissions, which allows investors operating in places like health or housing or energy to start looking at what are their climate impacts at an ultimate level. We don't have anything that's widely used like that for thinking about the well-being of society. We've actually started to experiment a little bit as an organization. It's something we've set up called the Impact Lab, at looking at actually the use of quality-adjusted life years as a way of distilling down a variety of different impacts, whether that be from things like housing or healthcare access or things like climate change, in a way that will help investors understand how to distill a lot of different negative and positive impacts in the world down to how they actually affect well-being of people. Now, we've seen actually some major institutional investors start to absorb, use this approach. It's very early days, and I don't know if that's the perfect solution for it, but something along those lines where we actually can help people understand in a very tangible and direct way, to go to Dr. Patz's kind of opening recap of the previous session. Tangible ways that people can understand these big conceptual issues, it will be incredibly useful in helping to drive greater action.
Great. Eric or Boon, would either of you like to jump in?
Yes, for sure. And I'd like to talk from the African perspective. which is that in the context of the economies in Africa, what we see as some of the challenges that tend to make it difficult for that convergence to happen are political instability. We see currency fluctuations. We see policy and regulatory uncertainty. These are some notable barriers that makes it a bit difficult to be able to attract private capital. And while these factors contribute to a perception of high risk among investors, it is important to recognize that the investment landscape on the continent varies across regions and across countries. People tend to feel that the countries are one and the same. They're not. There are lots of big differences across from the North Africa to Southern Africa and so on. In fact, there was a survey, however, that was undertaken by the African Private Equity and Venture Capital Association that found that 56% of limited partners see currency risk as a primary concern, while 44% of general partners are highlighting macroeconomic risks as impediment that they face when it comes to business. So these kind of perceptions, of course, we know can impact on investor confidence, especially when it comes to the long-term climate-focused projects that we're talking about here, which has a longer gestation period of time. Also, we note too that public capital that's where public capital, especially development finance capital, comes in to bridge that gap, to help mitigate some of these risks that we see, to assist in going to where private capital may not be very free to go to, or leveraging the development finance capital, some of the guarantees that they provide as a leverage, to attract additional private capital. And so while this risk may remain, but we see development finance, public capital that the bank brings on board that could help to mitigate some of these risks and provide guarantees that can help to ensure convergence take place ultimately, even if it's to a very limited extent.
Great. Boon, maybe I can ask you specifically in answering these questions to focus on whether and where you see tensions arise between or among national governments, banks, private capital actors, and philanthropy who may be operating with different definitions of value, and what impact that has on what we're able to accomplish here.
I guess between countries, obviously, there are issues with regards to national sovereignty issues and, stuff like that. Earlier on when we talk about forest fires, right? Although the forest fires affect Singapore, some of the forest fires were actually outside of Singapore. So Singapore does not have jurisdiction over, those countries. And, trying to impose a legalistic approach to it is actually, counterproductive or counterintuitive, right? And so I think the important thing is really to build a network of trusted partners across both government, private sector, and philanthropic. I think that's very important. We also believe that ideas doesn't have to only come from one place. Ideas can come from the world, talent can come from the world. So for example, we actually run global climate technology challenges in 5 countries: Singapore, Indonesia, Vietnam, Japan, and this year we're going to start one in China. The Singapore one, the thematic area has been around decarbonization, food nutrition, and for next year we're going to look at Cool Earth. So we've been running that for 8 years now. We've awarded grant money to deploy projects in countries. For example, in Singapore, we ran it for 8 years. So the different countries means the projects are deployed in those countries, right? And so I just give an example of Singapore. So in Singapore, we ran it for 8 years. We've given prize money to 11 startup companies as grants money for them to deploy the projects in Singapore. But in doing so, they partner with the Singapore government and the Singapore companies here. Singapore government is important because it allows policy facilitation engagement. Both the government and the private sector company can also fund it. So we provide grant money, but private sector can provide investment prize. So after 8 years, we have given $11 million to 11 companies. The companies collectively has attracted follow-on funding close to $600 million. So those are good, because if you want impact, you really have to think about finance. You need to think about financial sustainability, and impact is agnostic to whether you're public sector, private sector, or philanthropic sector. So I think a blended finance approach, impact investing, is so important. But you just need to get the stakeholders all together in the room. I mean, just one last point. Many philanthropic organizations operate in Asia, including Asian philanthropic organizations as well. But many tend to do things by themselves, by ourselves. And actually, many of the topics, many of the subjects actually overlap. If we could pull this philanthropic capital together, actually, there's a multiplier effect on society.
I used to sing that same tune when I led Rockefeller. It is, for some reason, harder to do than it sounds, but it is absolutely the correct suggestion here. We have some amazing questions from the commissioners. So let me use a few of them, and then I can come back to some of my own, but they're really useful, I think, for the conversation. The first is really emphasizing the poorest among us. And the question is, how can the impacts of climate change on the poorest be appropriately valued? For example, the biggest impacts of extreme heat on labor productivity is most likely on subsistence farmers and others working in the informal economy. But that is not accounted for in GDP, and so it's often sidelined in conventional economic assessments. What can we do about that? What should we be doing about that?
Yeah, I'll take this one. I think it's an excellent question that Andy raised. I would say it's actually a question beyond the specific topic of climate here. This is a question that is the eternal question. I work a lot on financial protection, household expenditures, and we don't know. So this is really beyond the issue of climate. And we just, in many countries, there's up to 90% of people living in the informal sector. And the sort of underlying question is, how do we value the time of people who don't work, in quotes? And I would even, Andy mentioned about the poorest and those in the informal sector. And then I would even say, I would also, in that regard, also think about women. We often don't value the time of women as well, which is another related issue, perhaps not to the subsistence farming that he was pointing to. But I think it's I don't have perhaps Liz has, but I don't have a specific remedy for this one. But I think it's a very important point.
Liz?
I don't have the remedy, but I think if we go back to things like sustainable development goals, what we can do already is we can attribute worsening food and nutrition to climate change. And then we can start thinking, linking back to Stéphane, some of those solutions, early warning systems, cash and food safety nets. And if we have better understanding of who's being harmed the most, we can start to target some of those interventions. I'll keep my answer short because there's lots of hands.
More variables are added by some of the other questions. So let me add two more. Demographic trends. So Stéphane referred to aging. Eric was talking about high birth rates in Africa. Obviously, the youth bulge in Africa is something that all of us have our eye on. How do these differing realities, and Boon mentioned obviously that there are geographic and regional differences, how do demographic trends affect investment decisions? And maybe climate migration is really also another demographic shift, and certainly has enormous economic and health and social impact. So can we add those variables in and re-answer the question?
I'm happy to try. There's lots of layers of complexity to this, but I think a couple of thoughts I wanted to offer. One is that this question on what's factored into GDP, I think, is hugely important. And for investors who are looking at investing in things like index funds for stock markets, et cetera, these top level economic indicators end up being quite influential. However, for many impact investors, they're investing directly into companies in markets all over the world. So a lot of the data they're looking at is less around what's factored into GDP, but much more about what are the realities of markets on the ground. And we do see quite a bit of interest among impact investors who are focused on some of these kind of more marginalized populations. So to give very concrete examples, things like smallholder farmers, who are, in some markets end up being really significant in terms of population and tend to be quite low income and part of the informal economy, but have huge implications if you care about inequality, if you care about local agricultural and food systems, and of course, things like health. And so this is actually a very high area of interest among impact investors because they see the need from the ground up. Similarly, kind of availability of financial services to female entrepreneurs in many countries, which may not be captured by top-level data, but is another area of interest that I think has profound implications for addressing inequities broadly, as well as health inequities. Now, when it comes to some of these other factors that you brought in, Dr. Rodin, from the questions, we do see similarly those realities on the ground informing how investors are making decisions. So for example, changing demographics mean people that need different products and services, whether it's health services or things like housing or others. Also means that you have a different labor force. So that which may pose opportunities for investment or various needs around where you have access to more entrepreneurial activity because you have more people entering the economy who want to start companies and things and maybe seeking capital. So, I think it's important. Obviously, we have a lot of people thinking about economic factors, which I think is really important, but also to recognize that some of this bottoms-up data and experiences in communities and in markets will also inform investment decisions in ways that I think could be quite positive.
That's great. Thank you. Boon, let me turn to you.
I just wanted to give an example of smallholders. Thanks, Amit. Palm oil. Palm oil per hectare of land. Actually, palm oil is one of the highest yielding vegetable oil and biofuel, but it's grossly overexploited. But when palm oil grows to about 20 to, and in Southeast Asia, there's lots and lots of smallholder farmers that plants palm oil. When palm oil grows to about 20 to 25 years, the yield drops. Right? And the trees get so high, harvesting becomes very difficult. And so when the yield drops, harvesting becomes very difficult, farmers' income drop. And so what do? They slash and burn forests and they plant more palm oil that causes degradation to the environment and health issues and stuff like that, right? And so to Amit's point, right, the business model and financial instruments are very important. So in everything we do, we don't only think about the planet and people, but we think about the financial sustainability and the prosperity of how that impact can do. And so in Southeast Asia, we are currently running a project with 400 smallholder farmers, 1 hectare each, so 400 hectares, and we're working with a Norwegian fund to provide a loan facility. So that smallholder palm oil has lots of issues. So when the palm oil grows to about 20-25 years, what they need to do is to actually do replanting, sort out the land titles, so that per hectare land they can. But so what we did is that we partner with a Norwegian fund, provide a loan facility. We guarantee the loan. So without the loan guarantee, interest rate would have been in the 20 range, double digits. With a loan guarantee, the interest rate comes down to sub 10%. And if the projects become bankable, the loan becomes accessible to smallholder farmers. And so with that pilot project, we're hoping that they can also tap into replanting grants by the governments as well to make it more financially accessible. And if that becomes successful, then that model can also be replicated across other places.
That's a great example of how philanthropic capital at the pilot phase can then be used to both demonstrate proof of concept, and then public and private capital can take it to scale. And we certainly need more of that as we push towards elevating the climate health nexus as the positive outcome that more investors and more capital really ought to be considering. There's another source of capital that one of our commissioners asked about, and that is the insurance industry. Obviously, at the primary level, the property and casualty insurers, the health insurers, and at the reinsurance level, where they really are underwriting all of these catastrophic losses. What have you seen about engaging them, and how do they figure into this valuation model?
I can share a couple thoughts on this. We do have a number of insurance companies in our membership, and it actually provides a nice tie into something that Dr. Robinson brought up, a question around fiduciary duty and what we expect of investors. Because I think one of the things that we see, of course, there's a whole conversation around that, like what insurance products are offered to the market, which I actually won't take up as directly as I will about how insurance companies invest all that capital that people pay in terms of policies, and this is the way that they take those huge pools of assets based on the monthly premiums and things that people pay into them, and then think about how do they actually have the financial capital available to pay obligations in the future. Ultimately, what this means is that we have many insurance companies who control tens and hundreds of billions of dollars in assets, and are very oriented around the long term. They have long-term obligations of which they may need to pay people out. So they need to make sure that capital grows safely. One of the things I think is a huge opportunity that this commissioner may have been speaking to is that long-term investors need the economy to perform in the long run in order to pay out their financial obligations. Same thing is true for pension funds, who may be paying pension funds 30, 40, 50 years out to people who are working today. This actually, if you think about the long term, and many of the data that we saw some of the economists present earlier on was thinking about the long-term impacts on health and climate and beyond. If you need financial returns in the long term, it means you need a sustainable economy, which means you need a sustainable society and you need a sustainable planet. So we actually see convergence of interest around making sure we do have a healthy population and we do have a healthy planet. Amongst these huge institutional investors like insurance companies because of their long-term obligations. I see this as and we've already seen a lot of data in our membership, but this is a huge area of opportunity because not only do they need to just think about how the world is changing, they need to make sure, and to the extent that they can as investors, if they can influence the trajectory of climate change and the trajectory of health trends in a positive direction, it actually points back to the existence of these institutions, their ability to sustain themselves. So I think that insurance companies are a huge area of potential, both when it comes to addressing climate change as well as addressing the needs for health in the long term.
Thanks. I want to turn to you, Eric, and combine a question that we have from the commissioners and put my own touch on it. The question was, how do we actually ensure that policymakers see these data and understand the full impact? And I know, obviously, sub-Saharan Africa, all of Africa is made up of different countries, but you also have very interesting regional economic associations that have developed over the years for economic collaboration and well-being. If you could both talk about what the national government policy makers need to see, but also how what we're talking about should be influencing those regional economic associations that are flourishing, actually, in sub-Saharan Africa in particular. You're on mute.
Okay. Yes, indeed. The policymakers, they need knowledge. And like I said earlier, what the bank is trying to do is to move away from just being an infrastructure financing institution to a knowledge generating institution. We call it knowledge bank. That's what we want to be. And the reason is because we want to ensure that knowledge is what drives operations and not the other way around. It used to be that operations drive knowledge, but now it has to be knowledge drives operations. And so what we do, therefore, we start with the diagnostics, which we call country capacity development needs assessment for each of the countries. In many cases, we see countries coming to us to request for this type of assessment. Then the country capacity development needs assessment feeds into what we call country diagnostic notes. And then the country diagnostic notes in turn feeds into the country strategy paper, which is what forms the basis for any operations, any support that we're given to country in terms of project financing. So what this means, therefore, is at every stage of developing these different knowledge products, we ensure that we engage with the policymakers, we engage with the authorities, we also ensure that we have their buy-in. In a number of them, they are sitting in the room in the process of preparing all these documents. And I give you an example. At our annual meetings in May, the vice president of a particular country walked up to us and said, I want you to assist me to assess my economy. I want to have a better understanding of the diagnostics. And when we started the process, he himself rolled up his sleeve and was with us in the room to ensure that this happened. So what we do is to create that awareness and ensure that policymakers are part of the process. Let me also give you another example at the continental level. And this happened as far back as 2022, but we finished the study last year. The chairperson of the African Union Commission approached the bank and said, I want you to help us work with our team to develop a strategic framework that is required for the countries to achieve between 7 and 10% GDP growth over the remaining life of the Agenda 2063. And between the African Development Bank, the African Union Commission, and the NEPAD, which is the implementing agency of the AU, this was developed, convening global researchers, policymakers, people who had, previously been engaged, in this area. So that helps us to see that there's that awareness, even among policymakers. It's not just all about helping them to understand what they need to do, but we see them now coming to make a request, specifically what needs to be done. And in addition to that, to closing, we have what we call a knowledge management unit within the bank, whose role is to, engage with the country authorities, all the 54 members of the country, all the 54 members of the bank, with a view to helping them understand some of the knowledge products that have been developed in their different areas that can help them to know what are some of these policy recommendations, what are some of the key actions for them to take. And we organize policy dialogues from time to time to convene them, to sit in the room and get to have knowledge of this information. So by putting this knowledge at the doorsteps, at the hands of these leaders, it makes it possible, like the inclusive growth study I mentioned, all the heads of state had access to they took the reports and took them home. And some of them have been calling us. We also recently developed the Public Service Delivery Index, which is one of the areas where many of the countries are lacking. The first of its kind, which helps countries to understand the gaps that they have with respect to their public service delivery, and more importantly, what is needed to close the gaps. So we regularly, engage the policymakers with these different knowledge products to help them understand what are the issues, and more importantly, what they need to do, action required to take.
That's a great example of evidence-based decision-making being enabled by a major financial institution. I do think that the basic research community often creates extraordinary metrics and then doesn't work hard enough to effect that translation for decision-making and into policy. And it's a gap that we need to fill, particularly if we're going to make this area work and change the metrics and change the valuation models, and something that I think we as a commission should be spending some time and attention on. We have run out of time, which is incredible, but I wanted to save 5 or 6 minutes for a kind of lightning round among the 6 of you, and ask each of you to quickly answer the following question. If we as the commission could push one catalytic change, to inform the shift in economically valuing climate health action, what should it be? What would your top thing be that we ought to be doing or recommending? Who would like to go first?
Okay, I will come on. I'm sure we should have prepared for this one, shouldn't we, earlier? I'm thinking maybe just how do we make much more visible these costs of inaction, especially for the lowest income people? Because the costs of inaction are not visible, and often the costs of inaction are outweighing the costs of, what am I saying? The costs of inaction are high. And, you know, we're always looking for how we can accelerate transformational change, tackling climate change. And so I think sometimes just reminding people that the cost of inaction are often greater than the cost of action.
Stéphane?
I'll take the next pass. So speaking of evidence to policy, I think we need something that is quantifiable, a quantifiable framework for priority setting in the health sector, speaking from the health sector, that can enable really tangible actions and that are efficient and as well as fair. So that's what I would look for.
Eric?
I'll push that we should be thinking about helping countries to develop natural capital accounting. Natural capital accounting that can help them to actually integrate their wealth into their GDP. For African countries, for example, this is one of the things that we've seen that's been lacking. So proper valuation and accounting for the rich natural capital that a number of these countries have will indeed assist them to improve their wealth and also to make them more creditworthy, and therefore being able to raise additional capital, whether public capital, whether private capital, whether philanthropies, which can help them to systematically and also substantially raise resources that are required for inclusive growth and sustainable development.
Great. Amit?
Yeah, I think from my vantage point, anything that we can do to help mobilize private capital to drive better health outcomes. So this could be at the level of fiduciary duty, like what Dr. Robinson was speaking to. It could be around creating clear metrics, as well as the incentives, that I think Boon spoke to as well. But I think this will help reduce the burden on public budgets and help drive more activity around how do we generate more kind of like progress on in the private sector around health outcomes and mitigating climate change. Thanks.
Great. And Boon, over to you.
It's interesting that both Eric and Amit I have the same opinion. Resources is the most important. Impact investing is key. And we always talk about better planet and better people, but actually we should think about better prosperity. So if I may, we should move from proof of concept to proof of value, and being able to scale it up and crowding in more resources.
I can't conclude better than that. We started by saying that it's what we value and how we define in new ways what we value. And you've really ended on that point as well. I want to thank all our panelists and discussion. This time just flew. And I think we've learned a lot. We've heard a lot of very concrete examples and a lot of concrete suggestions. And I thank you so much for this really remarkably interesting and important conversation.